So, what is home care? Many of you may have been confronted recently with this description of needing home care, but I will tell you, we often run into people who don't really fully understand home care, and oftentimes home care can be confused with home health if your loved one is coming out of a hospital. And I wanted to just try to simplify this today and talk a little bit about home care, what it is, and we're going to have another video in the future where we go into a little bit more comparison between home care versus home health. But the simple aspect today that we wanted to talk about is home care and what it can do and how it might benefit you and your loved one. My name is Troy Turner. I'm an owner with Right at Home. And today we're going to go into a little bit of detail about what home care is and how it might be able to benefit you and your loved one. Home care provides peace of mind by ensuring your loved one is cared for in the comfort and familiarity of their own home. It promotes independence while offering the support they need to thrive safely and with dignity. Services provided during home care may include things such as personal care, the physical assistance of providing help with someone. And these could be simple things such as help with bathing, dressing, feeding, physically helping someone toilet or assisting them while on the toilet. It could also include things that we call companionship. These might be very simple things. It may be helping someone to go to a theater or helping someone go shopping for themselves. Medication reminders can be a simple task that can often be forgotten, or maybe the medication and the timing of the medication is really important. And certainly during home care, you want to set this up and make sure that someone's doing what they're supposed to be doing and remaining compliant with their medication. Meal preparation. Meal preparation can be simple. Sometimes it can be as complex as making a meal from scratch for someone who has a special diet. But sometimes meal preparation can be as simple as the family's left meals and we just need to make sure that someone's around that can warm that meal up and present it to the loved one. And any other things that are involved around meal preparation, hydration, etc., that may occur, snacks, things like that may occur throughout the day. Light housekeeping can be as simple as tasks such as sweeping the floor, vacuuming, keeping the kitchen clean, straightening up the bathroom. All of these things can be potential areas that your loved one may need a little bit of assistance with, and providing some care in the home to help them get these things done or provide a level of assistance so that they can do them safely. Light housekeeping does not normally include things such as moving furniture around, assisting with painting a house. It normally does not involve scrubbing walls or scrubbing floors from a hands and knees perspective. These are things that we can certainly, normally you can get assistance with, but they usually are not part of the normal home care specialty, and they may involve bringing in a house cleaner or someone else that is more specifically trained and skilled to do some of these tasks. Transportation can be another aspect of home care. These are simple tasks usually. Honestly, the most common three are things that helping your loved one get to the doctor's appointment and making sure they get follow-up on seeing the doctors and making the visits that they need to, or getting to a clinic. Sometimes you may be helping people get to a dialysis center or other medical appointments that are really important. Transportation can also include getting someone to a shopping trip or getting to a pharmacy and making sure that we can pick up medication for someone. And these can be done with or without the client. There are times where some clients we don't feel comfortable leaving them alone. But from a home care perspective, transportation is usually involving, one of those three aspects. Mobility assistance. These are getting into personal care items, but maybe a little bit more physical. Sometimes pieces of equipment are used to help people be mobile or support their mobility throughout the household. Equipment is always an important thing, but sometimes the mobility assistance can be as simple as, a caregiver providing support as your loved one walks throughout the home. Has to navigate stairs, or getting in and out of a bed or sofa or other pieces of furniture that may prove to be a little bit more challenging than they were many years ago. Respite care is another aspect of home care, but respite care is just as simple as a little break for the family caregiver or maybe whoever's providing care on a normal basis. And respite care is usually just providing a little bit of care so that the loved one can get out maybe and do something for themselves. go to the hairdresser, see a movie, do some of those aspects of life that they enjoy, but they're not able to do those things as regular because they're providing care on a regular basis. And respite care is just giving the loved one or the family member a little bit of a break so that they can enjoy life and find a way to recharge themselves and provide care long term. Specialized care is another aspect of home care. Specialized care can be something like cognitive care and really helping someone provide cognitive care to those with dementia of some type. Specialty care can be considered different types of home care. 24/7 care is a term that you will hear people use, providing care round the clock, 24 hours a day, 7 days a week for someone. And there are home care agencies that also can help support what's called live-in care, where the caregiver is actually living physically in the home and maintaining coverage. There's sometimes limitations to what you can do in live-in care because the caregiver is required to get sleep and be rested to provide that care, but that is usually governed state to state with state laws and things like that. So, but all of these are aspects of specialty care that are considered home care, but may be a little bit unique to the situations that are present. So we spent a lot of time today talking about the services provided as a part of home care. Just want to spend a moment or two talking about the benefits of home care when all this comes together. Ultimately, the biggest benefit is the peace of mind gained by the client or the family's loved ones, that you know that things are taken care of, even without your minute by minute presence in the home. Some other things that come up is, along with that peace of mind, is just, personalized care that can really be tailored to what your needs are. If you're in a different situation, you may not be getting one-on-one service, right? We can promote safety and healing and recovery in the comfort of someone's home, right? We can reduce hospitalizations and readmissions because it's taxing on not just the family, it's also taxing on the loved one, right? And ultimately what we're all trying to achieve is to providing an enhanced quality of life for your loved one ultimately. To learn more about how you might achieve some of these same benefits with us, please contact us today at the link below.